Hi everyone, so today we'll be doing another mock USMLE question. This is going to be question number 11. So the question is, you have a 35-year-old male with a past medical history of schizophrenia who comes to your office complaining of ongoing social withdrawal, apathy, and anhedonia despite being compliant with his outpatient antipsychotic regimen for which he's on Risperdal. Which of the following is the most appropriate next step in managing his symptoms? Option 1 is increase dose of Risperdal. Option 2, discontinue Risperdal and initiate clozapine. Option 3 is initiate cognitive behavioral therapy. And the final option is continue current antipsychotic regimen. If you need some time, pause this question and take a second to think. So the correct answer is continue current antipsychotic regimen. So in order to answer this question, what you have to know is that when it comes to schizophrenia, the schizophrenia symptoms are divided into two groups, positive and negative symptoms. Positive symptoms include things like disorganized thinking, disorganized behavior, hallucinations, delusions. They're called positive symptoms because they essentially add something, to a patient's mental state where they're having things that they didn't have before, whether it be delusions, hallucinations. So those are all the positive symptoms. Along with the positive symptoms of schizophrenia, you also have negative symptoms, which include things like decreased motivation, anhedonia where they don't enjoy anything, and general apathy. Those are the negative symptoms of schizophrenia. The reason it's important to know that schizophrenia has those positive and negative symptoms is when it comes to antipsychotic medications that patients are started on for the treatment of schizophrenia, antipsychotic medications for the most part primarily help with positive symptoms. Often they don't help with negative symptoms. So that's something, when you have a patient with schizophrenia that is started on antipsychotics, it's important to counsel the patient that antipsychotics will often help with their positive symptoms, with their delusions, hallucinations, but very likely it won't help with those negative symptoms. And so that's why if a patient is on antipsychotic medication and it doesn't help with the negative symptoms, that's not necessarily an indication to change antipsychotic regimen. One thing that's also important to remember is when it comes to antipsychotics, for the most part, patients with schizophrenia are primarily prescribed atypical antipsychotics. And for the most part, all the atypical antipsychotics have pretty similar effectiveness in targeting the positive symptoms. But the one that you have to know is clozapine is considered more effective. So even though the rest of them have similar effectiveness, clozapine is in fact considered more effective. But clozapine, it's important to remember that is associated with agranulocytosis. So before prescribing that, it's very important to get a CBC and to make sure patients don't develop agranulocytosis. So once again, the correct answer in this situation is continue current management, as antipsychotics for the most part are meant to target the positive symptoms and not the negative symptoms. And just briefly, I just wanted to go over, I found this chart on the internet. So just to go over once again, what are the positive and negative symptoms of schizophrenia? Positive symptoms include hallucinations, delusions, thought disorders, movement disorders, and depersonalization. And negative symptoms, as mentioned, included having a flat affect, lack of pleasure with activities that patients once enjoyed, social withdrawal, alogia, which is poverty of speech, and last is loss of interest and motivation. So that's going to be it for today.